you know that Maryland is on lockdown. Gyms, stores, everything is on lockdown. And I know everybody's running around trying to get food, trying to get water, trying to get a whole bunch of things. But what I've seen is people going and buying a lot of sugary things. So what you need to understand is, even though you're in the house, the problem is your immune system is not being boosted, it's not being built up. And the reason why it's not being built up is because you went to the store and you bought a bunch of sugary stuff. Sugary stuff like sodas and candy and potato chips, all those kind of things, they suppress the immune system. Your immune system is your first line of defense. It's supposed to help you fight against the bacteria, against viruses. And it's not doing that because you went and bought some sugary stuff. You're buying food and things that you don't really need to buy. What you really need to be doing is getting some vegetables, not even a bunch of meat. You should be getting some vegetables and some fruits and some water and some different things like this. I'm here in the office, and this young lady right here, she checked my temperature. I couldn't even come in the office without my temperature being checked. I couldn't come in here without my temperature being checked, or just a big thing of sanitizer and sanitizing everything. Kelly, put it up to me again and check my temperature again. She's going to check my temperature again in the doctor's office. Yeah, come to me.
Okay.
Come on, she'll take my temperature again. You got to have the right temperature. You can't even come in the doctor's office. I got a good temperature, right?
Yes.
I couldn't even come to work unless they checked my temperature. My temperature had to be checked before I could come to work inside the office. And so we're in here, and people are in here. I can't show you the patients, but the people are in here, and we're talking about a few things of being able to do preventive measures. So we're doing what we call preventive medicine coaching at this point. Preventive medicine coaching is what we're doing at this point. And I made some notes for you guys because I'm really concerned the fact that they've got Maryland on lockdown. They're closing everything. And they're going to take everything off the food shelves everywhere. They're going to take it all off everywhere because they got to sanitize, and some of the things have been compromised because, people went in the store and they was touching things. And so they're going to take everything off the shelves of the store. And so I made a few notes for you guys. One of the things that you're going to have to do is you're going to have to boost your immune system. They're going to shut down a lot of things where you will not be able to go a lot of places. And they're probably going to put in effect that you have to go in house at a particular time. Your immune system is continually responding to indigenous stimuli. And you need to understand something. You don't get enough rest. You don't get enough sleep. You don't exercise. Your stress is up. That's compromising your immune system. Relationships or the air we breathe. The body always looking for ways to maintain homeostasis. And so you got to learn how to practice deep breathing because you got to build up your immune system. You got to do that. And so I'm going to go online in a little while, and I'm going to talk about boosting your immune system. I'm going to talk about how sugar suppresses your immune system, what's really going on when you intake some of the foods that you're taking, and why my job is so important in terms of helping people with the preventive medicine coaching and medicine treatment. That means working right beside primary care, chiropractors, and any other kind of doctors, working right beside them so that we can help you, educate you, and move you through the process. So that's our job. Because, doctors are getting people in and doctors are getting people out, but they don't have the time nor the expertise to spend with you to make sure that you understand what you should be doing for optimal health. They're not educated that way. They are educated for disease care, period. Symptom care. That's all they're going to do. The other part of that has got to come up to healthcare providers such as myself. And so we've got to do a couple things with you. Preventable healthcare management is one of the biggest things that we've got to do with you. And we got to work alongside your care provider to be able to do that. That means we got to give you what is called personalized science-based coaching. We got to emphasize some things to you. One, behavior change. If you don't change your behavior, you're constantly doing things over and over and over again, you're going to have some problems. And in order for you to move past what's going on in your life right now, you got to do more than wash your hands. You can wash your hands all day long, but if your behavior stays the same, you are compromising yourself with disease and with viruses, with infections. You're doing it. The way you're eating, not exercising, not getting enough rest. All those things go along with it. You can wash your hands from here to God come. But if you don't start exercising, if you don't start resting, if you don't relieve some of this stress that you have in your life, your immune system is going to be compromised. All the sugary foods that y'all were piling in those baskets. I was in Safeway. I was in the supermarket. I was in South Carolina this weekend and teaching and doing business. And I saw people in the store, and they were loading their carts up with sugary foods. I was amazed. Do you not know that you're suppressing your immune system? You actually shut your immune system down with soda. Soda, whether it's sugar-free or whatever, you shut your immune system down with the stuff that you eat. And the fact that you do not exercise at all and you don't practice deep breathing, you're actually not building your immune system at all. So there are things that you're going to need to do. Other thing that you need to do right now in terms of preventive measures is you need to start taking some vitamin D. I know you get some from the sun, but you also need to take some vitamin D. You got to strengthen your immune system. Amazon is not delivering anymore. They are not delivering anymore, and those stores are closing. So what we've got to do is look what's in your house. And we're going to talk about what's in your house and what to use in your house so that we can kind of help you build your immune system. So I want to look in your refrigerator and then your freezer, and we're going to talk about what to do, some of the herbs and things that are already in your house. We're going to really talk about that later on today, about what to do to build your immune system to help you fight against this virus. And they call it, the name of it is really called, and we're going to get into that too, because it's like a crown. The virus actually looks like, the cells are like a crown of thorns. And so that's why you get that name in terms of the virus is coming from and how that thing affects your body. It's actually limiting your respiratory system. It's a respiratory illness. It's exactly what is going on. That's why I'm talking when I'm talking. Is because what we're in threat of is our respiratory system. That's why they tell you if it's not affecting your breathing, then don't go to the hospital. They want you to treat the symptoms differently. And so we're going to talk about that a little more later on. But what I want to hear from you is, what have you been doing? Are you sleeping? Are you resting? Did you stop eating the sugary foods? Do you have lots of fruits and vegetables in the house along with the water? I want to know what you're doing. Let's help each other out. There is something else that is going on. They're now saying that we're overwhelming the healthcare system. The healthcare system is overwhelmed. And so they're asking for cooperation from the public and cooperation from private centers like the one that I'm working in now and the one that we own. Listen to me real quick. That's going to be powerful and important. How do we partner with that? One is by educating you. The other is really doing some preventive measures. If you're not already sick, how can we help you not be sick? That's the most powerful thing that we've got to be able to do. And so Sunday we spent time in church talking about how God had saved Israel from a lot of diseases with dietary measures, things that they were supposed to eat, things that they were not supposed to eat. And that same God is telling us again today the things that we're supposed to eat and things that we're not supposed to eat. And then tells us how to stop disease at the gate, how the prophets stop disease at the gate. And so we have to learn how to operate within the Bible. It's not enough that he would that we prosper, be in good health, even as our soul prosper. Actually, is that your soul prosper, you be in good health, and you prosper. It's backwards. It's not enough that he's the Lord thy God that healeth thee. You got to pay attention to what you are consuming in your body. You got to pay attention to what you're doing with yourself. You got to pay attention to all those things. The Sabbath, getting rest, all that was a part of a protection for your body so your body can build up. The whole thing about Sabbath and having a rest and not doing anything and being informed and being educated. That's why you're supposed to go to church, because the preacher was supposed to inform you about how you're supposed to live and the changes that you need to make so you can have a better life. And we've done everything in church other than being informed about having a better life. we pointed things towards going to heaven. Heaven is heaven and hell is hell. But listen to me, you got to live here, right here. And so we got to make some changes in the way we do things. And having preachers who are trained in mind-body medicine is important to us. We've got to get some things done. And I hope I'm not overloading you, but I'm going to use some terms and terminologies later on today that's going to help us understand what we're doing. But my concern, I came on because we're on lockdown. Maryland is on lockdown. They're closing everything. They're on lockdown. DC is going on lockdown, and they are closing everything. So what is it that we're supposed to be doing? And so I want you to get with me later on today. I'm going to announce when I'm coming on. I'm going to tell you specifically what it is that you need to be doing from healthcare providers, what you need to be doing. We're going to also give you evidence-based, science-based things, reports that need to be utilized, the things that you really need to be doing so that you can protect yourself. And a lot of gatherings that we were once being able to go to, it's going to be shut down because the world is panicking. They're trying to figure out what to do. That office is loading up over there, the main office, with people coming in because they're feeling symptoms. They're feeling symptoms. They're feeling bad. They're scared. They're psychologically going through the stress of this whole thing of being quarantined or possibly getting the virus. It is crazy out here. And we've got to do some real talk for you. No, as believers, we're not scared. We're not afraid, but we do need to be informed. Let me say that to you again. As believers, we are not afraid. No, we are not. But we do need to be informed because what casts out fear is information. That's why he said, I don't have the spirit of fear, but love, power, and a sound mind, which means you are informed. Because of the information that you have and the acceptance of the information, because you accept it, it becomes a part of your life, you are not afraid. You're only afraid of what you don't understand. What you don't understand makes you afraid.
I heard this is Facebook Live now. I'm going to have to join the situation.
Now listen, this is the doctor right here.
Man,
this is the main doctor.
I'm just a supporting factor. I'm like a nurse here to the realest doctor.
Dr. E, I was talking to them about their fear. One, from psychological fear, and then fear of the virus itself, and then the immune system and what they should be doing to boost the immune system. Right. So I'm gonna let Dr. E kind of tell you.
Well, I mean, you know a lot about that. You probably mentioned some of the stuff. Turmeric is a big one for me that I've noticed. It's a huge anti-inflammatory. It's a big immune booster. It's as strong as Advil. And you guys should be taking that. I would recommend about 500 milligrams a day. Just on a general basis. Vitamin C, oranges. But the more you can get from the food is better, right? So you always want to get it organically from the food, but supplement yourself with these kind of things. So you don't want to just be like, don't eat fruit, don't eat vegetables, and just take supplements, right? I'm sure Doctor agrees with that.
Yeah, vitamin D is going to be important for you too.
Yeah, vitamin D is important. That's a big lack in the country.
That's a big lack in the country.
Everybody's inside. Nobody gets the sun anymore.
Absolutely. Yeah. So you're going to need that. Now, this is the main doctor. This is the brain of the whole operation.
No. I'm behind. You see why I'm standing here? There's a reason why I stand behind. I'm not over here. You know what I mean?
I listen to this guy right here. You hear me?
I'm the other way around. Don't listen to me. I'm just repeating what he's telling you.
Now, Dr. E, can you give them your address and where they can find you?
Sure, yeah. So Metropolitan Headache and Spine, me and Dr. James are in the same place. We are a chiropractic and physical therapy rehab center. We deal with strengthening, physical alignment, spinal alignment, neck pain, headaches, migraines. Dr. James also works with weight issues, psychological aspect of it, things of that nature. So we also have personal trainers here. I mean, it's all inclusive. Anything physical, even mental, we can help you with, and to kind of get it right. Because sometimes it's psychosomatic. Your brain, with all this virus, all you hear in this stuff is taking over the world, and it's causing somatic problems. Then you have body pain from it. So we have to beat the somatic issues and the psychological aspect together. We can't just do one or the other. You're not going to get the full service.
Yeah. Now, I also want to remind you something that even though he's a chiropractor, who's also trained in physical therapy, but he's also trained like a primary care. Because you go to medical school, you're still trained the same training.
Right.
So
Right.
he's that first line that will send you to somewhere else.
Absolutely.
That will refer you to somewhere else. So that's why we listen to this guy right here.
Yeah, well, I try to, when patients come in, we take a full exam, right? We
Right.
want to make sure what's going on with their internal issues and external, based on what they're saying.
Right.
So based on examination, we may send out right away. We might send out for MRIs, CAT scan, X-rays, or specialists, internal or external, depending on the scenario.
Right.
And then, but if it's physical, it's somatic issues, then we keep it in house.
You keep it in house.
Unless somebody needs surgery for whatever reason. We'll figure that out. Usually they figure that out before they walk in here. But sometimes, if you have a rotator cuff, issues and stuff like that, we'll take an MRI. If the tear is really bad, we send out for surgery. If it's mild to mediocre, we can generally fix it here as well. Just depending on the scenario. If you have disc problem, we can fix here, depending on the disc issue. If it's, really bad, we call it extrusion or sequester disc injuries, we send out for that. Protrusion, disc bulges, we fix that all here. So it depends on the scenario. We're going to fix that up. And we talk about structure dictates function. If your structure is like this, your shoulder is down, your pelvis is down, you have scoliosis, then you're never going to get better. So we have to line you up. We have to make sure all the nerves are working, everybody's happy.
Nerves are working, and strengthen the muscles around the skeleton.
Absolutely. Then the strengthening comes in and holds it there.
That's right.
If you're just strengthening on a crooked spine, if you have pain, then you cannot push through pain, try to get stronger. First, we have to get you out of pain. First, move well, then move often.
Right.
Right now?
Yeah. And so we're going to help you build your immune system. I want you to get in here. We're going to help you build your immune system, tell you what you need to do, your structural pain, all those things. Don't worry about it. I told you when I went in there, they make sure, check the temperature, make sure that nothing's going wrong. We're doing all the preventive measures in the world, so you don't have to be afraid to come into the office.
Yeah.
Come on into the office,
Absolutely.
and let's get some things worked out.
Let me throw a couple of things. We taking everyone's temperature. First thing, my secretary does that right off the spot before you barely even enter through the door. Then at that point, every 30 minutes, we're cleaning all the sofas, everything, every 30 twice every hour. Then all the tables in the rooms are constantly being cleaned after every single appointment. Every single patient walks out, we're cleaning. Walks out, we're cleaning. Then everybody sends it. They're washing hands. We're washing hands. Hand sanitizer. I mean, we're going through the roof. If you're healthy, if you're young, you're okay. You can do certain things like that. Just don't go into people. We have to listen to the CDC. Nobody more than 50 people of accumulation at a time.
Right.
So keep it under 50.
Right.
But you can do. But if you have immune issues, if you have cancer, heart disease, lung issues, internal disorders, kidney problems, then you should stay home. You should take those precautions.
Right.
But if you're generally healthy, you're feeling good, you don't have any sickness, you don't have fever, you don't have a cold. We want nobody that has any issues here. Okay.
Right.
So if you're feeling anything outside of that, you can come in. But if you have any of those, stay home. It's better to stay home. And
follow those instructions in terms of building your immune system when you stay home. All right? And stop eating that sugary food. I'm telling you, it's compromising, suppressing your immune system. Sugar will hurt you.
Yep.
All right? So throw the sugar out right now.
100%. And text Dr. James if you want the address again, 50 South Pickett Street in Alexandria. We also have one in D.C. as well, but the Alexandria one is big. It's a nice facility. We're here Monday to Saturday, 7 to 7 most of the days. So come in, call us, ask Dr. James for the number. We'll give it to you on the spot, and we'll get you taken care of.
Thank you, Doc, for coming in.
Appreciate you, man.
All right.
Thanks so much.
All right. Don't forget what I'm telling you. Get rid of that sugar. Throw that sugar out immediately and stop eating all those things. Don't drink any sodas because you're compromising your immune system. Throw those sodas out. And you guys are going to have to cook at home. And we're going to talk about what to cook. We're going to talk about what to eat. We're going to talk about a whole lot of things that you really need to be doing. And I want you to get up and get some exercise because you've got to boost that immune system. You can't go to the gym. The gyms are being shut down. So you're going to have this whole exercise regimen and program that's going to be at home. We're going to do it. And we're going to talk about respiratory scenarios and what you should do and how you should feel. I'm Dr. James. It's good to see you. I'm going to come back online. We're going to give you some information that's going to be really, really good for you. So I want you to follow me as we go. Okay? Talk to you soon.